Diabetes is one of the most encountered impairments in life insurance underwriting. According to the Centers for Disease Control, 34.2 million people, about twice the population of New York, have diabetes, with 26.9 million diagnosed cases and 7.3 million cases undiagnosed. Given the prevalence of this condition, this video will help you better understand diabetes so that you will know what questions to ask when you come across a client with this history.
There are generally two types of diabetes, type 1 and type 2. Type 1 diabetes is often referred to as insulin-dependent diabetes and occurs when a person's pancreas produces little to no insulin. Clients with this type of diabetes often require treatment with insulin. Type 2 diabetes is the most common form and affects how the body processes blood sugar or glucose. Type 2 diabetes is usually treated with oral medication. Type 1 diabetes is the more severe type and is often diagnosed in childhood and known as juvenile diabetes. Lastly, gestational diabetes is a form of diabetes affecting pregnant women. While diabetes may disappear once a woman gives birth, insurance carriers still underwrite these cases with caution, as those who develop gestational diabetes during pregnancy are at a higher risk of developing type 2 diabetes later in life. The age of onset and years since diagnosis are important factors. Diabetes has several long-term effects on the body and organs. Complications from diabetes can include cardiovascular disease, nerve damage or neuropathy, kidney damage, also known as nephropathy, and eye damage or retinopathy. The longer a person has diabetes, the more likely additional organ damage will arise. For example, most carriers will not insure clients diagnosed with diabetes before the age of 7, and several will not consider clients diagnosed before the ages of 18 to 20. The later in life the diagnosis occurs, the better the underwriting outcome may be. While most cases of type 2 diabetes are controlled with oral medications, some milder cases may even come under control with diet and exercise alone. Clients with more severe cases of type 2 diabetes and the majority of those diagnosed with type 1 diabetes will need insulin to control their disease adequately. Underwriting offers can be more favorable for people who manage their diabetes with diet, exercise, and oral medication, while insulin-dependent diabetics can experience more unfavorable underwriting. The most commonly used measure of diabetic control is the A1C test. This test measures the percentage of hemoglobin, a protein found in red blood cells that carries oxygen and is covered in sugar, also known as glycated. The A1C test result reflects the average blood sugar level over the past 2 to 3 months and is used by insurance carriers to determine the level of diabetic control. An A1C of less than 7% is considered optimal control and may earn your clients underwriting credits. The higher the A1C reading, the higher the rating to possible decline. People with diabetic complications, such as those affecting the kidneys, eyes, or circulatory system, will carry higher ratings than people who do not have these issues. Other adverse medical histories combined with diabetes are referred to as comorbid conditions. They can include coronary artery disease or cardiac disorders, cerebrovascular disease or brain disorders, and peripheral vascular disease or circulatory disorders. Tobacco users may also be assessed a higher rating than non-tobacco users.
Now that you know the 5 most important questions to ask, you can quickly gather the information needed to provide your Crump underwriter with what they may need to give you the most accurate quote. You can find our diabetes questionnaire on your Crump website. For a more in-depth look at underwriting diabetes, including the most favorable factors, look up our What You Need to Know About Field Underwriting with a focus on diabetes, also found on the Crump website. Contact your Crump underwriter today to discuss the most favorable carrier options for your clients with diabetes.